Hey, it's Dr. J. I want to welcome you back to the Cash Practice Solution podcast. And today we're going to talk about one of the bravest things I've ever done. Hello, welcome back to the Cash Practice Solution podcast. I'm your host, Dr. J. I want to tell you about one of the bravest things I've ever done. It was get counseling. I went and got counseling for premarital stuff when my wife and I decided we were going to tie the knot. And the pastor who was going to marry us told me it'd be one of the bravest things I ever did. It was brave. Maybe not the bravest thing, but it was brave. And today we're going to talk about something that's a really kind of fresh out of the box form of counseling, super effective, actually a lot of fun. It doesn't take a lot of bravery. It takes more just energy and excitement. We're going to talk about somatic experiencing as a form of counseling. And today I have a special guest who is not only a friend, but a colleague. We work together here in the office. His name is Luke Dale. He is a licensed professional counselor. And I'm going to let him give you a little bit of detail about his background and his training and why he's so awesome.
So, licensed professional counselor, as Dr. J said, I work primarily with a group of people that have everything from just some basic stress in their day-to-day life all the way to, highly traumatized, just really rough life experiences and everything in between. So I work with them on managing their stress all the way to releasing the stress and trauma that they've experienced in life. And so that's primarily done through, as Dr. J said, somatic experiencing, which is a body-oriented treatment that combines the mind and the body, not just focusing on the mind, which is what most counseling does, but integrating the body into that care.
Yeah.
So
well, and I think really what's important about that too is to understand that as a physician, I'm taught the body's safe. You're allowed to play in that area as much as you like. But stay out of that counseling place. That's a dangerous area. And what you find over time is that everybody needs counseling. I have done some counseling and really benefited from it. And I find that counseling it is a brave thing to do. It has been very effective, but it doesn't seem to equip you with the ability to kind of take that same experience and then move from that relationship, having that conversation, and then out into whatever else you're doing effectively. I think I got there sometimes from praying, sometimes from conversations. I do have friends that I can have conversation with and make progress with.
Yeah.
But
Yeah, exactly what you're talking about. That's the reason why I was drawn to somatic experiencing particularly. Is because of the whole idea of resilience. And so for me in my own personal practice, one of my goals as a professional is to equip my clients with the skills and the techniques that they can use for their entire life. And so when they come in the first 3-5 sessions, some of my clients, they stop right there and they say, I have the tools necessary to actually go and live the rest of my life confidently. I can handle the stress that comes. And so somatic experiencing, just like what you're talking about, it actually does create that lasting change.
It's interesting. It makes me wonder. It's like in 3 or 5 sessions, it seems pretty miraculous. That's pretty fast.
Yes.
Are they people who are high functioning pretty well?
Some that are high functioning, but a lot of my more, critical, high intensity clients, I mean, we're seeing rapid change in 2 sessions. Just by getting some of those key understandings in place, they can actually see where in their life they need to adjust or change to actually start moving in a really positive direction. So, but yeah, a lot of my higher functioning clients, they really just want to dive in, learn those skills to manage, like people that are, serial entrepreneurs or people that, are high-ranking chief executives. They just want those skills to be able to manage the stress in their life.
Right.
And so, yeah, somatic experiencing, it's a trauma treatment from its origin, but a lot of the core principles of the theory translate into just basic stress management and also just enjoyment in life. And so, which is part of the reason why it pairs so well with what you do in the office of bringing people holistic wellness. Yeah, exactly.
Right. Mm-hmm. So I was going to ask you, like, how does it work? But is there something like a real simple exercise you could teach me?
There's a really simple technique. It's called the VOO. Basically, the way that you can think about it is just by making the noise VOO with your mouth. And so a lot of somatic experiencing is slowing everything down. It's coming into awareness of present bodily somatic experiences. And so noticing the change in sensation in the body. And so the VOO, what it does is it helps our body drop into that deeper level of regulation. So
that's fun.
Yeah.
Yeah. Mm-hmm. So do I just say VOO?
Yeah. So we can do it together. So I'll show you first.
Yeah.
So the way that it usually goes is, again, we're going to slow everything down. So we'll do a quick inhale through the nose, pause, and then just VOO. And then you always leave enough air to exhale at the end to deepen that.
Do I have to go as low as you?
No. I don't know if you can.
I don't think I can. Let's try that one again.
Yeah.
Okay.
So again, just in through the nose.
Right.
Pause. Voo. So a lot of people, what they experience is a lightening in the head. Mm-hmm. They'll experience some sort of tingling in the hands or the legs. And so as you practice that, what people start to notice is that their experience of the change in their body actually starts to deepen.
Right.
They become more aware. So the first time it goes further and further. Yeah, as they get used to the experience. The whole theory is rooted in something called the polyvagal theory, which is basically it splits the vagus nerve into a couple of different functions, two of which being the dorsal, which is the shutdown or freeze, sympathetic chain, which is separate from the vagus nerve, being the fight or flight.
Right.
And then the ventral vagal, which is regulation. And so what the VOO does is it helps people move from that to some sort of sympathetic activation.
Like panic?
What do you mean?
Like when I'm hitting the VOO, I'm going in like this, and I'm gonna.
Exactly. Yeah. And so we're helping the body, like drop down into that regulation state.
Yeah.
So it's great.
Yeah. Well, it's interesting because in the cash practice solution, the idea is we're taking all of the things that we use in our practice that are effective to not only help us get great outcomes in patients, but also improve our income so that our business runs really, really well. Mm-hmm. So the outcome that we're looking for with our patient is total wellness. So body, soul, and spirit. That means that their body's in harmony with their soul, with their mental health to a degree, and that spiritually that aligns so that they can carry out the highest wishes of their heart, right? And then they're mentally capable and physically capable of doing that and integrating this. Because we're in a cash practice environment, we can do it. The thing about this is, and the reason I like it so much is because I'm offering my patient a very high value solution. I'm saying to them, this is going to be fun. As opposed to it's the bravest thing you're going to ever do because it's so terrifying. You and I did a session a long time ago when we first started messing with this as a point of interest, and I think we spent 45 minutes of a long time.
Yeah, it was a long
but we planned to spend half of that time, whatever it was. We went double time because it was so much fun, and I got so much out of it. And I wanted to interview you on this podcast so that we could talk about if you can integrate something like this into your practice. It is a national movement of integrating mental health into primary care, where if you can get a primary care and mental health wed to a degree, you're going to have much better results with your patients across the board. In a cash practice, because you don't have to get approval from the administrator of a plan or from someone who agrees with diagnoses, you also don't have to submit a bunch of diagnostic paperwork, which to some people is terrifying. That does worry them and make them nervous. And I do understand because they don't want that kind of paper floating around saying that they have some kind of mental health problem. They prefer not to have that. And in our environment, that's not necessary. Mm-hmm. And also, we treat people who don't have mental health problems with this methodology. We're treating ulcerative colitis and all sorts of physical problems that I consider very traumatic. I mean, your body hurts. Your body's not acting right. It's traumatic. So somatic experiencing helps you not only get a hold of the emotional part of it, the anxiety or the fear or whatever, but also how your body physically is going to react to that mental process. Is anything you want to say about that?
Oh, absolutely. Yeah, so much. Yeah. I'll fight for the mental health folk out there of how important mental health is in the treatment of physical issues. A lot of people think that mental health is primarily for depression, anxiety, psychological trauma, things like that. But in all reality, there's really effective mental health professionals out there that are treating these physiological, biological issues, things like neuropathy. And again, we don't think about this as we're healing them or curing them through these mental health treatments, but stress can, cause all sorts of inflammation of different issues in the body. And so just the management of stress alone through these psychological methods is going to radically increase the effectiveness of medical treatment.
So you want me to help you on that one? Because I got a really good one.
Yeah.
So when you put a patient in the ICU, in the intensive care unit, it used to be customary, you would start them on steroids because it's such a stressful environment that you have to give them intravenous steroids to keep them well, because otherwise the upregulation of their system is going to be so extreme. They're going to go through all their steroids and their inflammation will become so severe, it will impair their breathing, their blood pressure will go up, they'll have all these. And if on the other side you can and get that handled, and I think that's a brilliant way to look at it, to see it. It's like it can be that extreme,
yes,
and we're dealing with people way pre that.
Oh yeah.
So so I think that's one where you're looking at critical acute care medicine, where you're all the way to the level of you're going to be put on a ventilator if you don't calm down. You better chill, buddy.
Yep, exactly. Yeah. And I've seen people in those, high stress release states through the physiological emotional releases. And just through these simple practices, watching them actually regulate and then watching as the body heals live in that moment because they were able to reach that regulation.
What do you see healing? What is that?
So the different physiological releases, things like allowing the body to do things like cry. That's the mobilization of the stuck energy inside of the body. I'll see people, as odd as it sounds, I'll see people start to shake or tremble, and it's actually the body releasing that energy. And then you can see them automatically. The body automatically knows to do these things because it's going through the healing process. I was working with one woman that has neuropathy down in her legs and feet. And just after a few minutes, she started shaking in her upper body, had this massive release, huge sigh. And she said on the drive home, it was the first time in weeks that she had complete calm and peace in her legs, all because of a couple of minutes of treatment.
Very cool.
And so, that's some of the stuff we're seeing.
This episode is brought to you by Esprit Health, the game-changing platform for cash practices that are ready to level up. With smart, intuitive AI tools that sharpen your clinical insight and streamline your business, Esprit Health helps you run a practice that's not just efficient, it's enjoyable. So if you're ready to break up with that cranky old EMR and finally experience tech that makes your life easier, come on over to esprithealth.com and see how thoughtful technology can transform your practice. And hey, don't forget to subscribe so you never miss an episode that delivers the freedom to choose and the power to heal. Now, let's get back to the show. What other methods work like that? What other things could you do for her in that context where she'd come in a room and you'd say to her, "So tell me about your childhood."
No. There's not a lot else like this out there. Yeah.
So I mean, there's no other like a psychotherapeutic modality.
So there's other iterations of some sort of psychosomatic integrated approach, but nothing with this level of effectiveness. Yeah. That's the thing. If there was something better out there, that's what I would be doing.
Yeah, well, that's kind of where I was taking this.
Yeah.
Yeah. And for me, I know that in our training as osteopathic physicians, we go through laboratory stuff in our second, third, fourth year of medical school. And you put your hands on patients and you work with them and you're trying to get them to do that where they just let go and they can finally breathe. And it does work. I mean, it's a very well-known physiologic pathway. It's not a mental health thing so much as it's a normal thing. People hold tension in their body and they won't let it go. And when you feel them actually let go and breathe, you know you've reached kind of the primary endpoint of that treatment. So that's the one point at which like they can let go and they can breathe, their diaphragm relaxes, and then you kind of have reached that, like, okay, then you're on to your next movement or whatever, because you've reached that goal.
Yeah.
So I imagine you.
Well, and that's the mind-body connection.
Right.
You know, they're so interconnected, and for so long counselors have only approached it from the mind side, and many physicians have approached it from the body side, but we are learning more and more that we have to bring them together.
Yeah.
We just have to.
Yeah. Yeah. I'm thinking of that one patient with the bowel disease. Inflammation is the cause of pretty much everything big, bad, and ugly. So heart disease, Alzheimer's, cancer, everything really bad, it kind of starts with inflammation. And inflammation is an immune function, and immune functions can be controlled by stress control. When you control stress, you control inflammation. And you can actually look at blood counts and look at the inflammatory cytokines, the cell signaling molecules or cell signaling chemicals, and you can see, we're doing better. Those numbers are lower. And we can do that just through getting patients to laugh. Bernie Siegel in Love, Medicine, and Miracles did his deal, and you're doing that with Somatic Experiencing. In what we're doing in the office, every patient who comes in, we put them through our Esprit software, where we analyze and evaluate their mental health, their hormonal health, their digestive health, their structural health, every imaginable part of their health. And we're asking them questions, and then we come up with a score. Where do you seem to have your biggest problem? Where do we need to focus our work at first? Digestive, the gut-brain connection. Oh, yeah, gut-brain connection. So we'll treat the gut, and frequently we'll treat the gut, and thinking will get better, depression will improve, and we've done nothing else, right? Yep. If, on the other hand, we treat the gut-brain connection at the same time we treat the brain-gut connection, so we're getting them from both sides at the same time, our goal is to create a functional environment where we're improving not only the gut, but the brain or the mind at the same time, and thinking process, so that we're going to get both to improve at the same time. When that happens, somebody's going to get faster healing. They're going to get better faster. And because we're in a cash practice environment, what I can do, and this is the methodology I'm sharing with you in terms of how do you do it? What's the nuts and bolts? The nuts and bolts are, I'm in my patient interview and possibly usually a first visit, and I'll say, hey, would you like to talk with someone about getting some of these physical responses under control so that we could get your disease process healed faster? And almost universally, the answer is, yeah, duh. That's what I'm here for. And I'll run down the hall, and if Luke's not in a session, which he too often is, I'll have him run up, and then you'll meet with the patient, and then what happens? Yeah,
well, I mean, obviously it's learning their story is a huge part of it. And you taught me that, right. And so understanding where all of this is rooted. Is it in one very specific instance? Is it rooted in, something that's currently going on in their environment? And from that point, we start with very first creating a sense of safety and regulation in the body and their environment, because all of the healing that we do is in the context of safety. There's a ton of research that shows that the body actually starts to unwind, and like things like digestion starts to increase, heart rate variability starts to increase as people come into that sense of safety in their environment. And so it's forming relationship, it's getting to know them and their story, and then creating that.
Do you get that in the first visit? Like, can you connect with somebody in 5 or 10 minutes and get some of that?
Oh, totally. Yeah, absolutely.
That's cool. That's a really...
Which is a huge thing in the medical field, because all of that, a lot of people entering into doctors' offices feel that, well, this is going to be invasive, or this is going to be, rough on my body. I don't know what's happening. And so there's already fear and a lot of tension and stress that's building. So there's a little bit of like a threat response where they're, either physically turning away or
the
mentally
blood
turning
pressure
away,
goes
or
up.
the blood. Yes,
Because
exactly.
it always is. The patient says, it was 130 over 76 at home. It's always been 130. Well, why is it over 200 over 140? Because you're so nervous. Because they're freaked out.
Yeah, and that makes me think of, there have been a few times where Dr. J has treated somebody right before I saw them, or I worked with somebody right before he treated them. And I know that, at least for me, the sessions that I have with people right after you treat them, it's like we're, 100 yards ahead.
Oh, you mean the OMT, like doing hands-on work?
OMT, or just some sort of, interaction with you to start softening, and then they come in with
like the safety, from the safety context.
Yeah,
that's interesting. So what I am doing with this interview with Luke and with the somatic experiencing is basically we're kind of pressing a frontier where in our world right now, everybody recognizes that mental health services are under available or less available than they should be. There's a push to get mental health into doctors' offices. I don't see that happening readily because people don't feel safe. They feel like, oh, I'm not going into that mess. So I'm always working on creating an environment for them like, hey, you should check this out. This is actually enjoyable and you would actually enjoy the experience. And I have a high enough trust level with most of my patients that will work out. I know you just started doing some myofascial training.
Yeah.
And I was wondering if you wanted to share a little bit about, because I do osteopathic manipulation. So I put my hands on people, and sometimes I'll do this element called myofascial release, where you really gently stretch the tissues and you cause the body to go through that experience of somatic experiencing. You help the body along. That's my job. I assist the body. So tell me about your thing with John Barnes, what you did.
Yeah. Cool. So John Barnes, myofascial release training. I took their initial course a couple weeks ago, and have been absolutely loving getting to integrate that aspect to the psychological. They pair so well hand in hand. With anything, there's a physiological blockade that needs a psychological, touch. There's also psychological blockades that need a physical touch. And so having the ability to even just kind of direct clients to even do it themselves to break up the stored stress and trauma. I've been seeing a lot of those releases much more readily, much more actively in sessions. And that's the whole thing is, again, we're just getting back to the mind-body connection and the importance of integrating the holistic being who a human is.
Yeah, well, and it's interesting because it's been thought of in the past as, oh, it's kind of like fringy, edgy, fruity, whatever. But now the whole community of medicine is saying, we need mental health help. We need it. So now we're moving in that direction. I think we're moving in that way very effectively. In this situation, I think we could almost treat probably half of our patients, 50%, with somatic experiencing alongside of their regular treatment that they're getting. And I do sit and I'll have a conversation with patients about what they're going through in life, but I don't have the time to do a really good job counseling. I just don't have the time. And I don't have the training to be great at it. I really am working towards that in what we're doing. But I find that this creative thing that we're doing here is made available because we're in this cash practice space. If I see something that will help the patient's outcome, then I'm going to apply it. If I find that it doesn't improve their outcome, like you were saying, if it's not effective, I'm making them spend a whole hour and $150 or $200 or whatever the fee is for the work that they're getting. If I'm doing that, that's not going to last long. They will not continue to pay it, or I'll withdraw it because I'm not seeing any benefit. I just won't recommend it. On the other hand, when this works, right behind it, the income of the practice will improve because I'm getting better results. I'm getting better results with patients. When that happens, you can't keep it quiet. Jesus begged, hey, everybody, hurry up, get me out of here because the crowds are going to swamp me. I'm going to get covered up. So you don't have to worry about the news getting out. If you're doing a great job, it'll get out. So speaking of running away from crowds, who's doing somatic experiencing in our world that's killing it, doing a great job?
Oh yeah, Peter Levine. Peter Levine. He wrote a book called Waking the Tiger. That was kind of the thesis behind this entire theory. It's digestible for everybody from counselors to doctors to I've given it to clients before for them to read. It's amazing. It lays out the entire theory, the understanding of where all of this comes from, how it works in the body, and it even has some personal exercises to try to to start developing some of these skills. Yeah.
I like that.
Also, Stephen Porges, everything that he's written about polyvagal theory, that's where a lot of this came from. Bessel van der Kolk, his book, The Body Keeps the Score, has a lot of, I don't fully agree with everything that he's written in there, but the whole idea that the body stores trauma and stress, and that we can see physiological, biological issues arise from, lived experience.
Is there a better one book? Is like Waking the Tiger the best one?
Waking the Tiger for Somatic Experiencing is going to be the best book.
Okay.
Yes.
Yeah.
Yeah.
That's good. Yeah. And I think I want to encourage all of our watchers, listeners, to get involved in a creative application of what do you think is going to help your patients get better faster? Is having a mental health person going to help? If you're going to do mental health, do something great. Either find somebody who does amazing talk therapy who's going to help your people just feel incredibly connected and feel like they're on the right path, or they do somatic experiencing and can actually give them tools to get well. Or if you find somebody who does physical therapy really well, or a chiropractor or an osteopath, or someone who's got great hands and can really work with people and knows exactly what they're doing, finding those things, applying them in your practice, and then seeing if your outcomes are getting better, your income will follow, and you can just take it to the bank, and that's going to work. What I'm seeing is that we're constantly growing in a very creative way. And the environment now, because of the cash practice solution it's kind of acceptable now. It's something that I think our world is ready for. We're seeing it grow every year significantly, 10 to 20% every year, if not more. And I think it's going to grow even faster coming forward. What we're going to do in the future is kind of work through this somatic experiencing to a higher level, and maybe do another episode, maybe do a couple of exercises, and maybe teach some of those
theory
things
and stuff like that.
And for you guys who are afraid of going into cash practice, we'll teach you a few voos of your own you can do, and you can have some fun with that. I'm finding though that it's an awful lot of fun to be able to pursue practice from the perspective of how can we help patients get well and not worry about coding and approval and all that other stuff, and really stay focused on the main thing, which is helping the patient get better. And when you do that, when the outcomes improve, your income will always improve. I want to thank you for tuning in to the Cash Practice Solution Podcast. I'm Dr. J, and I'm here to remind you that a fulfilling cash practice is within reach, and we can help you get there. If you want to optimize your current cash practice or start a new cash practice on the right foot, check out all of our resources at cashpracticesolution.com. So until next time, listen to your patients. You do that. Yeah. Learn their stories, and love them with all your heart, and you will be unstoppable.
Thanks for joining us. And if you have enjoyed today's conversation, be sure to hit subscribe so you don't miss out on future episodes packed with insights to help your cash-based practice thrive. And don't forget to check out all the tools and resources available at cashpracticesolution.com. They're free to you, and we're always adding more. Keep raising the bar in patient care. We'll reconnect in the next episode with more ways to help you succeed.